Okay, my name is Dr. Amr Sheikh. I'm a GP and also a cupping practitioner. And today I'm going to show you how we recommend a normal consultation for cupping therapy is done according to the guidelines of the British Cupping Society. So surprise, my name is Dr. Amr Sheikh and you've come to the clinic today. How can I help?
Well, thanks for inviting me in. One of my friends asked me to come to see you because I've been having really bad back pain for the last year now. And I've tried many things. I've been to the GP sent me to the physiotherapist. He also sent me for an MRI, and the MRI didn't really show anything, and the physiotherapist hasn't really done a lot for me either. And now he's given me loads of tablets, and I'm getting really constipated with them, and it's really beginning to affect my mood. And one of my friends had cupping therapy done, and he told me that it'll work really well for you. So that's why I've come to you, hoping that you'll be a solution to all my problems.
I'd just like to ask you a few more questions before we talk about the cupping therapy. So how long have you had your back pain for?
Well, it's been going on for about a year now.
Okay. And during that time you said you've had some tests done and seen the physiotherapist. Now, the pain in your back, is it always at the same place or does it travel around anywhere at all?
Well, it's funny you say that because normally it starts in the lower back and sometimes it can shoot down my legs. Okay. Normally more on the right side than the left.
Okay, and how often do you get the back pain?
If I'm working, so I work in a restaurant as a chef, and if I've been lifting some heavy boxes, it can make the back pain worse. Normally if I'm at home and I've had a rest for a few weeks, then the back pain goes away. So I would say once a month at least now.
Okay. So activity makes it worse,
yes.
And you get it once a month.
Yeah.
And how many days does it typically last for when you do get the episode?
Between 5 and 7 days.
Okay, and how does it get better? Just with rest, exercise or painkillers?
With rest and painkillers, and if I don't work.
Okay. So, do you have any other medical problems apart from the back pain?
Well, I've got high blood pressure, and that's it really.
Okay, so now I'd like to ask you a little bit about your past medical history. You've had this back pain for a good time now, and you've also got high blood pressure. How long have you had that for?
Well, the blood pressure, I've had that for about a year now as well.
Okay, and now I'm going to ask you about some of your medications that you're taking. You mentioned about the painkillers and how they're not agreeing with you. Can you remember the names of any of those?
Paracetamol is one of them.
Okay.
And I think my GP tried me on codeine, but that wasn't really working for me. And then they've given me something called tramadol, which is really quite strong, that is.
Yes. And what about the high blood pressure? What do you take for that?
At the moment, my GP said to me, just reduce the amount of salt that you take in your diet, but you don't really need any tablets for now.
Okay. With regards to the cupping, I'd like to ask you if you're taking anything to thin the blood, so anything called aspirin or clopidogrel, warfarin, anything like that?
Nothing like that, no.
Okay. And I'd also like to ask you with respect to cupping, because it involves some blood, have you ever been diagnosed with any infections of the liver, like hepatitis or any other illnesses?
No, nothing like that.
Fine. Have you had cupping therapy done before?
Well, this will be the first time.
Okay. So there's no history of cupping in the past?
No.
Okay. And if you don't mind me asking, what do you do for work?
Well, I work as a chef in a restaurant.
Okay. And do you smoke?
No, I don't smoke.
Okay. And do you drink much alcohol?
Well, I don't drink at all.
Oh, that's good. Okay. Alright. Now, I'm just going to go back slightly. You told me that you had some physiotherapy for your back, you had an MRI scan.
That's right.
Did that show up anything at all?
Well, the physiotherapist said that I probably got maybe a slip disc, and they were trying to do some exercise to relax my back. The MRI showed that there was a minor disc bulge, but it wasn't significant. It wasn't very important.
Okay. And what's helped the most so far?
Well, really, the painkillers have helped, but it's just the side effects that I can't really take very well. If I don't work. But obviously I've got a young family and kids to support, so that's not a choice for me, I have to work.
So you've explored some other treatments, and you chose to have cupping done or to come here today for cupping therapy. What are your expectations from the cupping therapy itself?
Well, I'm hoping, as my friend described, that it'll help to get rid of some of these symptoms that I'm experiencing that's affecting my quality of life and the ability for me to work. As long as it can reduce the amount of times I get back spasms, it'll be a result for me.
Okay, fine. So So I'm just going to summarize now. You've had back pain for over a year. You've had some tests on it. You've tried some painkillers and physiotherapy. The MRI scan shows there's nothing too serious going on in your back. And what you want from the therapy is just to have longer episodes in between your back pain, so that you get on with your normal daily activities.
That's right, yeah.
Okay, that's great. What I'd like to do now is I'd like to just do a brief examination.
Okay.
And then just to check if it's safe to proceed with cupping therapy.
Okay.
And then I'll explain the procedure to you.
Okay, fine.
Alright.
Fantastic, thank you.
So I'm going to examine the patient now. We've got a good history from the patient, a good detailed history about medical history, social history, and what the patient expects from their cupping therapy. The next step is to examine the patient to make sure everything's okay physically to go ahead with the cupping therapy. So that's what I'm going to do now. So when it comes to the examination of the patient, we do a general and a specific examination. For this patient who specifically come with back pain, that would involve a full back examination. Generally speaking, for all patients, we do recommend that temperature, heart rate, respiratory rate, and blood pressure are measured at a very minimum, just to make sure that all the vital signs are within the normal parameters and it's okay and safe to proceed with the cupping procedure.